In this video, I am going to discuss a very important topic. I found in my day-to-day practice that parents get worried and distressed when they see their children with fits while having high-grade fever, especially those children who have first-time experience of fits. The question is, what happens when a child experiences a fits while having high-grade fever, what we call as febrile seizure? It's a term that might sound intimidating, but understanding it can provide peace of mind and arm you with the knowledge to handle such a situation effectively. Please subscribe and like my page. Let's discuss what is febrile seizure. By definition, are convulsions or fits that can occur in young children, typically between the ages of 6 months and 5 years, caused by a sudden spike in body temperature. These are often linked to common childhood illnesses such as ear infections, tonsillitis, or even the common cold. A febrile seizure might look alarming, but it's important to know that they are usually harmless and often don't indicate a serious health problem. Most children who experience febrile seizures don't have epilepsy or brain disorders, and they don't cause any long-term damage to the nervous system. So why do they occur? Parents always ask this question. The answer is still a subject of ongoing research, but it's believed that the immature brain of a young child reacts to the rapid rise in body temperature by triggering a seizure. Some children may also have a genetic predisposition to febrile seizures. Because the chances of having a seizure are increased if a close family member has a history of them. Around 1 in 4 children affected by febrile seizures has a family history of the condition. Next question is what to do during a seizure. Yes, this is very important to know what to do if your child is having fits during fever. First of all, place them in the recovery position, lay them on their side on a soft surface with their face turned to one side. This will stop them swallowing any vomit. Keep their airway open and help prevent injury. Stay with your child and try to make a note of how long the seizure lasts. If it's your child's first seizure or it lasts longer than 5 minutes, take them to the nearest hospital as soon as possible or dial for an ambulance. While it's unlikely that there's anything seriously wrong, it's best to be sure. Don't put anything, including medication, in your child's mouth during a seizure, because there's a slight chance that they might bite their tongue. Almost all children make a complete recovery after having a febrile seizure. Now, how are febrile seizures diagnosed? It's not through a specific test, rather. Doctors diagnose febrile seizures by examining the child and obtaining a detailed medical history. They'll take into account the child's age, the nature of the seizure, and whether the child has a fever. And in some cases, tests may be conducted to identify the cause of the fever. Now, what is the treatment? As I mentioned earlier, that the febrile seizures are due to high-grade fever. So in that way, our main aim is to lower the fever as soon as possible, especially for those children who already have previous experience. Reducing a high temperature can help make your child feel more comfortable. Paracetamol and ibuprofen have been shown to be effective in reducing a high temperature. However, they won't reduce the chances of your child actually having a seizure. Removing any unnecessary clothes and bedding will also help to lower your child's temperature. It's also important to prevent dehydration during a fever by making sure your child drinks plenty of fluids. In summary, febrile seizures are convulsions in young children triggered by a rapid rise in body temperature, often due to an underlying illness. They can look scary, but they're typically harmless and don't indicate a serious health problem. Remember, it's essential to keep calm, if your child experiences a febrile seizure. Get them to a safe place where they won't hurt themselves, and once the seizure is over, seek medical advice to treat the underlying cause of the fever. Febrile seizures are a common part of childhood for many, but with knowledge and understanding, they don't have to be a source of fear. After all, knowledge is the first step to handling any situation with confidence and calm. Thanks for watching. Please follow my page for more upcoming videos.